Hello everyone. In today's session, we'll be learning about the muscles of the posterior compartment of the leg. In the previous session, we had learned about the muscles of the anterior as well as lateral compartment, and this is the compartment which is left, and we'll be covering it through the anatomy decoded notes. Okay. So first, let's try to identify the region of the muscles of the posterior compartment of leg. Here we can see the right-sided lower limb muscles in an anterior view as well as posterior view. Okay. So look at this region here. This is the region of the posterior compartment of the leg. Okay. This region is also referred to as calf region, where there are calf muscles. The muscles that we can see here, this is the gastrocnemius muscle. There is a muscle deep to it called as soleus muscle. They form the bulk of the calf. Okay. And there are few muscles deep to it. We'll see all of them. Okay. So total number of muscles in this region is shown in this table. Okay. We'll be learning about the 3 superficial muscles and 4 deep muscles. Okay. And in the previous videos, we have covered all these muscles. If you all have not seen that, please go through the lower limb playlist. You'll get the videos of all the muscles. And in the next video, we'll be covering this muscles of the sole of the foot. Okay. So first, let's try to identify the muscles in this schematic image. Okay. This is the right-sided leg region viewed from the posterior aspect. First, orient yourself. Okay. There's a superior part, inferior part, medial and lateral. Okay, right leg we are viewing from the posterior aspect, and as I said, in the superficial group there are 3 muscles. One is gastrocnemius, then next is soleus, and one more is plantaris. Okay, posterior compartment is further divided into superficial and deep muscles. Okay, deep muscles are shown in this image. Okay, deep muscles are 4 of them. One is popliteus, which is seen in the floor of popliteal fossa. And there are other 3 muscles which we can compare with the muscles of the anterior compartment of the leg. Okay, in the anterior compartment there is tibialis anterior muscle. The corresponding muscle here is tibialis posterior. Okay, and in the anterior compartment there are muscles called as extensor digitorum longus, extensor hallucis longus. The corresponding muscles here are flexor digitorum longus and flexor hallucis longus. Okay, so like this there are 4 deep muscles, and with these images try to understand the origin and insertion of these muscles. The gastrocnemius muscle, as we can see, it is having 2 heads of origin. Okay, medial head as well as lateral head. The 2 heads are uniting to form a tendon. This tendon is called as tendocalcaneus, also referred to as Achilles tendon, which is going towards the calcaneus bone. Okay, and if we see the muscle which is deep to gastrocnemius, that muscle is soleus, arising from the tibia as well as fibula, and this muscle also fuses with the tendon of the gastrocnemius. Okay, and this muscle plantaris arising above the lateral condyle of the femur, and the tendon of the plantaris also merges with the tendocalcaneus. Okay, plantaris muscle is having a small belly and a long tendon. Okay, that is seen here. And identify the muscles. This popliteus muscle, there's a triangular area in the tibia, upper part of the posterior surface of the tibia. Above the soleal line there is an area for popliteus, and this other attachment is on the lateral condyle of the femur. Okay, look at these muscles, the flexor digitorum longus, flexor hallucis longus. Flexor digitorum longus is arising from the tibia. Okay, the medial bone is tibia, and the tendon will actually go to the lateral 4 toes. Okay, and the flexor hallucis longus muscle, this muscle is arising from the fibula, and in its course it will cross and go medially. Okay, fibula is the lateral bone, but this tendon crosses and goes medially towards the great toe. Okay, so in their course, this flexor digitorum longus and flexor hallucis longus, they cross each other. Okay, medial bone is giving attachment to the muscle which is going laterally. Lateral bone is giving attachment to the muscle which is going medially. Okay, this one little crossover you have to remember here. And in between these 2 muscles, there is this tibialis posterior muscle, which actually arises from tibia, fibula, as well as the intervening interosseous membrane. Okay, and if we trace the distal attachment, it goes initially up to the navicular tuberosity. Okay, navicular is one of the tarsal bones, and then it gives slips to all the tarsal bones except talus, and further it also goes to the base of the middle three metatarsal bones. Okay, so brief overview of the attachments we have seen in this image. Now let us understand them in details, okay, through this table. So this table will show the origin, insertion, nerve supply, action, as well as will identify them in this cadaveric images which are there. Okay, so gastrocnemius muscle, as we know, there are two heads of origin. So medial head and lateral head, both are arising from the femur. Okay, medial head will arise above the or superior to the medial condyle, and lateral head is arising from the posterolateral surface of the lateral femoral condyle. Okay, insertion we have seen tendocalcaneus. Nerve supply is tibial nerve. Okay, if you see carefully, all three superficial muscles, gastrocnemius, soleus, plantaris, they are supplied by tibial nerve, as well as the four deep muscles that we saw, those are also supplied by the tibial nerve. So basically all muscles of the posterior compartment, they are supplied by the tibial nerve. So this nerve is the nerve of the posterior compartment of the leg. Okay, and action of gastrocnemius is plantar flexion of the foot at the ankle joint, and also it can cause mild flexion at the knee joint. Okay, same action is for soleus as well. And for plantaris, it is a very weak plantar flexor, okay, since it is having a very thin tendon. Okay, and let's see other headings for the soleus. Origin, on the tibia there is a line called as soleal line, and there is an area above it. Okay, and there is a tendinous arch between tibia and fibula. Then insertion we have seen, nerve supply we have seen, action also we have seen for the soleus. Plantaris is arising from the lateral supracondylar line and also the oblique popliteal ligament of the knee. Insertion is tendocalcaneus, nerve supply tibial nerve, and action is weak plantar flexion. Okay, let's identify these three muscles here. Number one muscle is gastrocnemius. Okay, and when we cut the gastrocnemius, here we can see the cut ends of the gastrocnemius. And this number two muscle is soleus. Here in this image, soleus muscle is also cut to expose the other deep muscles. Okay, then along with the lateral head of the gastrocnemius, we can see one muscle, that is the plantaris muscle. Okay, that we can identify here as well. This one is the plantaris. Okay, and there is one term used here called as triceps surae. Should know this. Triceps surae means the two heads of the gastrocnemius along with the soleus. These three together are referred to as triceps surae. Now let's see the applied anatomy of these muscles. The soleus muscle is referred to as peripheral heart because it has large venous sinuses inside it, and the contraction of the soleus helps in sucking of the blood from superficial veins and propelling it to the deep veins and then further towards the heart. Okay, so soleus is referred to as peripheral heart. Then fabula is a bone which can be seen in the tendon of gastrocnemius. Okay, it's actually the origin part of the lateral head of gastrocnemius may have a bone called as fabula. Okay, then tendocalcaneus we have seen, it is a conjoint tendon of gastrocnemius and soleus, which is together referred to as triceps surae. It is the thickest and the strongest tendon of the body, around 15 centimeters long. Okay, then calcaneal tendinitis, tendocalcaneus which is attached on the calcaneus, that gets inflamed, okay, due to repetitive stress. So what happens in it, there are microscopic tears of the collagen fibers in the tendon just superior to their attachment on the calcaneus. Okay, then gastrocnemius and soleus can be tested. For that we have to ask the patient to stand on the toes and plantar flex the foot, and if normal, the tendocalcaneus can be seen and palpated above the heel. Okay, and tendon grafting, the plantaris muscle is referred to as vestigial muscle. Okay, because action also we saw it has a very weak plantar flexion, so the tendon of plantaris is usually used for reconstructive surgeries of the tendons of the hand. Okay, so three muscles, but there are a lot of applied anatomy related to them. Okay, now let's see the deep muscles. This table shows all four deep muscles. So first muscle mentioned is tibialis posterior muscle arising from the posterior surface of the interosseous membrane. Okay, there is a membrane between tibia and fibula that is referred to as interosseous membrane, and adjacent parts of tibia and fibula. Okay, insertion we saw it's primarily on navicular tuberosity and then all the tarsal bones except talus, as well as on the base of the second, third, and the fourth metatarsal bones. Okay, nerve supply for all muscles is tibial nerve that we have seen. Then action of tibialis posterior is inversion of the foot as well as plantar flexion of the foot, and also it supports the medial longitudinal arch of the foot. Okay, then flexor digitorum longus muscle arising from the tibia. Okay, digits are lateral, the muscle will arise from the tibia. Okay, and the name is digitorum, so it will go up to the digits. Okay, base of the distal phalanx of lateral four toes. Nerve supplies tibial nerve, action is flexion of the lateral four toes. Okay, then flexor hallucis longus, hallux is present on the medial aspect, great toe is referred to as hallux. It will arise from the lateral bone, fibula is the lateral bone, okay, as well as adjacent interosseous membrane. It will go up to the distal phalanx of the great toe. Now supplies tibial nerve, action is flexion of the great toe. Okay, then next muscle mentioned is popliteus, arising from the lateral condyle of the femur. There is a groove called as popliteal groove and it has got an intracapsular origin. Okay, muscle arising inside the capsule of the knee joint. There is one muscle which is having intracapsular origin in the upper limb. Which muscle is that? Yes, it's the long head of the biceps brachii, which has got an intracapsular origin. Okay. Insertion is on posterior surface of the proximal tibia. There is a triangular area above the soleal line where it inserts. Nerve supplies tibial nerve. Action is unlocking of the knee joint. Unlocking is the process which takes place in the initial stages of knee flexion. Okay. So in applied anatomy also this is mentioned, unlocking of the knee joint. So what happens here? Lateral rotation of the femur on the tibia occurs during initial stages of flexion, because there is a movement called as locking in which there is medial rotation of the femur which is occurring. Okay, so lateral rotation of femur will occur in unlocking done by popliteus muscle. And this also we saw crossing over of the tendons of flexor digitorum longus and flexor hallucis longus. Okay, then there is a term called as beef to the heel. The flexor hallucis longus muscle, it is the only muscle which is fleshy at the ankle as it enters the sole of the foot. So it is referred to as beef to the heel. Okay, other muscles at the level of ankle, they become tendinous. The tibialis posterior, flexor digitorum longus, their tendons would be seen, but flexor hallucis longus will be fleshy at the ankle. Okay, so that's why it is referred to as beef to the heel. Let's identify the four muscles in this cadaveric image. The first muscle that we can see here, that's the tibialis posterior muscle. Okay, then second muscle here is flexor digitorum longus muscle. Okay, arising from the tibia. Then number three muscle is flexor hallucis longus. Flexor hallucis longus is quite fleshy as we see down towards the ankle. Okay, then popliteus muscle. This muscle is seen in the floor of popliteal fossa. Okay, so all these are the four deep muscles. So we have covered all the muscles with their origin, insertion, nerve supply, action. Okay, and make sure you all access these notes. Even hard copy of the notes we have made available for students. You all can scan this and buy from the store. Okay, thank you.